Hello, this is Dr. Grande. Today's question is, what is emotional switching with borderline personality disorder? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about the term switching with borderline personality disorder, we're talking about changing emotional states from positive to negative or from negative to positive. We would refer to changing within a type of emotional state, like negative to negative or positive to positive, as simply emotional changing. Now, borderline personality disorder is a cluster B personality disorder. That's the dramatic, emotional, and erratic cluster. So it's in the same cluster as antisocial, narcissistic, and histrionic. And of course, all of these are documented in the Diagnostic and Statistical Manual. Now, we see 9 symptom criteria for borderline personality disorder. Only 5 have to be met for diagnosis. We see frantic efforts to avoid abandonment, unstable and intense relationships, identity disturbance, impulsivity, suicidal behavior, affective instability, chronic feelings of emptiness, inappropriate intense anger or a difficulty controlling anger, and paranoid ideation. Now we can see how a number of these symptom criteria could be connected to this concept of emotional switching. The impulsivity, the affective instability, the unstable and intense relationships, that's the idealization, devaluation cycle, and even the anger. So a lot of the symptom criteria seem to be connected to this idea of changing emotional states from positive to negative or from negative to positive. Now again, changing emotions within the same polarity, so positive to positive or negative to negative, is not emotional switching. I'll just refer to this as emotional changing. And the most common emotional changes that have been observed in the research are anxiety to sadness, sadness to anxiety, and anxiety to anger. So all of these changes are within the negative polarity. So they're all moving from one negative emotional state to another negative emotional state. Now in 2016, a study was published by Hubin and colleagues that looked at this idea of emotional switching. And they looked at emotional switching at a few different levels. The probability that a change would occur, so the probability that somebody would go from negative to positive or positive to negative in terms of emotional state. This was referred to as switching propensity. And they also looked at the size of the change, the magnitude of the change. And this is referred to as switching distance. So you have switching propensity and switching distance, both being measured in this study. Now this study had 30 participants who had borderline personality disorder and 30 participants who did not. So an experimental group and a control group. And over the course of 8 days, the emotional states were measured 10 times a day. Now the results of the study were actually quite interesting. With the idea of emotional propensity, the probability that somebody would change from one emotional state to another, change the polarity, there was no difference between the experimental group and the control group. So this was a bit of a surprise. In terms of the switching distance, there was a difference. There was a larger difference in the experimental group, so the individuals with borderline personality disorder, but only when the polarity was changed. So only when it was truly emotional switching. In terms of emotional changing, moving from negative to negative or positive to positive, there was no difference between the experimental group and the control group. So this finding was a bit of a surprise, because oftentimes when we think of borderline personality disorder, we do think that somebody could be more likely to change from one positive state to another positive state or negative to negative. Now, according to this research study, that's not the case. Now, there were some real limitations here with this particular study. Most of the participants with borderline personality disorder in the sample were female, and all of them were in residential treatment. So they were in a hospital being treated for borderline personality disorder. So it's not really clear how well we could generalize the findings from this sample to the larger population with borderline personality disorder, but still this is an interesting finding. This finding is consistent with some of the ideas we have about borderline personality disorder, like dichotomous thinking, tending to think of situations as either all good or all bad, and the idea of idealization and devaluation, those unstable and intense relationships. So an individual with borderline personality disorder would be more likely to have a large shift when moving from positive to negative or negative to positive. So emotional switching is an interesting construct. I would be interested in seeing more research on this subject. And of course, this type of information, these type of results, give us information that we can use to plan treatment more effectively for individuals with borderline personality disorder. I hope you found this description of emotional switching and borderline personality disorder to be interesting. Thanks for watching.